Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you nerve flossing exercises for dorsal scapular nerve entrapment. The dorsal scapular nerve stems from the fifth cervical spine nerve roots. It runs down the back of the neck and into the mid-back. It innervates levator scapula muscle, which lifts the shoulder blades, and the rhomboids, which also lift the shoulder blades and retract the blades, meaning to pull them together in the back. Compression of the dorsal scapular nerve typically occurs through the middle scalene muscle in the side of the neck. And this causes pain between the shoulder blades, limited range of motion, and winging of the scapula. There can be many different causes of nerve entrapment. Some of the most common are postural faults, direct trauma, excessive muscular development in the neck and upper back, and repetitive overuse in overhead athletes and various occupations. Nerves do not like to be stretched, and pulling on both ends of the nerve at the same time does not help to release a pinched nerve. Instead, nerves respond well to a gliding or flossing motion, which means to gently pull one end at a time. This motion helps to gently mobilize the nerve through the area where it is pinched. The movements are performed gently in slow and smooth repetition. There's no hold involved. While performing the flossing exercise, it's normal to feel mild discomfort and mild numbness and tingling. The numbness and tingling should not be severe, and it should dissipate within a few seconds of completing the exercise. If numbness and tingling become severe while you're doing the flossing movement, then stop the exercise, rest, shake it out. Try again after the numbness and tingling resolves or returns to baseline. These movements should not be painful. If you experience pain during the exercise, stop and adjust your posture. Make sure that you're not pulling on both ends of the nerve at the same time. Make sure you're not pushing too far into the movement. And this will become clearer as we go through these exercises. And here's a quick reminder, if you like this video, click the thumbs up and consider subscribing to my channel. Okay, let's start with a quick postural correction, and then we'll jump right into the 3 flossing exercises. Starting at the base, put your hands on your hips and make sure your pelvis is in neutral alignment, meaning that you're not tipped too far forward and you're not rocked back into a slouched position, but you're right in the middle. And now moving up your spine, just feel your low back and make sure that you have your normal curve. And then moving up, lift your chest, relax the shoulder blades down and back, and do just a little bit of a chin tuck to make sure that your head is lined up over your shoulders and your trunk. The first flossing exercise is a neck side bend. If we're working on the right side, I want to anchor my right arm first to prevent the right shoulder elevating during the movement. So place your right hand underneath your thigh, or you could hold on to the front or the side edge of your chair. Okay, with the right arm anchored, continue looking straight forward and bend your head to the side, lowering your left ear toward your left shoulder. Pause, and then come back up to the center. Again, tip your left ear toward your left shoulder, pause, and return to the middle. Continue with slow, smooth motion. Pausing at the bottom of the motion, pausing at the top of the motion. Continue bringing your ear toward your shoulder. Don't lower your head down this way or lift your head up, but keep looking straight forward. It can be helpful to match your breathing with the movement to calm your nervous system and to maximize the release. Inhale through the nose to prepare for the exercise. And then exhale as you tip to the side, lowering your ear toward your shoulder, pause, and slowly come back up to the center. Again, inhale, and exhale, bend to the side, pause, and come back up. Inhale, and exhale through your mouth as you lower left ear to the left shoulder, and come back up. Okay, now let's switch sides. So I'll release my right arm, shake it out if I need to, do a couple shoulder rolls if that feels good, move your head around a little bit. Okay, and now for the left side. First, anchor your left arm, hand under your thigh or holding onto the chair. Just let your right arm relax wherever it's comfortable. Again, be sure you're starting with upright, tall posture. And inhale to prepare. Exhale, tip your head to the right side. Ear goes to the right shoulder. Pause and come back up. Inhale through the nose. Exhale, tip to the right. Right ear to right shoulder. Pause and return to the center. And again, inhale. Exhale, tip to the right. Pause and slowly come back up to the center. Continue with slow, smooth motion. Tipping your right ear to the right shoulder with a pause at the bottom of the movement, and slow, smooth motion coming back up to the center and pause at the top of the movement. Shoot for 10 repetitions. Start with what feels comfortable for you and build up with daily practice. The next flossing exercise helps to mobilize the nerve a little bit farther down the path in the upper and mid back. To floss the right dorsal scapular nerve, I'll be using my right arm. Bring your arm out to the side, palm facing forward, elbow bent. Now lift the arm with slow, smooth motion overhead as far as it feels comfortable for you. And now on the way down, turn your palm so that the back of the hand is forward or your palm is facing back. Bring your palm just behind your hip. Pause here and then come back up again, swiveling or rotating your palm so that the palm is faced forward when your arm is up in the air. Pause and then slowly lower, keeping the elbow bent and rotating your palm so that the back of your hand is now facing or touching your hip. Now I'll show you on the left side. Now reach your left arm out to the side, elbow bent and palm faced forward. Lift your arm up overhead with slow, smooth motion, and then slowly lower. Bring your elbow back toward the side of your trunk, and now rotate your palm. So now your palm is facing the back of the room. And the back of your hand is touching the back of your hip. And then lift your arm, rotating your palm forward. Pause at the top wherever it's comfortable for you, and then lower. And rotate your palm backward. Pause and continue, alternating lifting of the arm with lowering of the arm with slow, smooth motion. The last flossing exercise also flosses the lower part of the nerve. To floss the right side, again, we'll be using the right arm. Bring your arm across your chest with the palm faced down. Now tip your head down and turn so that you're looking toward your arm, or looking down into your armpit. Pause here. And now as you bring your arm out to the side, rotate your palm so your palm is up. And turn your head to the left. And pause here. And then as you reach across with your arm, you'll be turning your head at the same time. The palm goes down as your head tips down. Pause, and then open your arm up to the side, palm goes up, and turn your head to the left. Continue with slow, smooth movement, crossing your arm, rotating palm down as you look down into the armpit, and then opening your arm, palm up, and look to the left. Pause. And again, come across, palm down, look down, and then open your arm, palm up, and look to the left. The best way to match breath with this movement is to exhale when your arm is across your chest, and to inhale when your arm is open and out to the side. So we'll exhale as we cross, and then inhale through the nose as you open. exhale through the mouth as you cross. And inhale as you open. Okay, continue with slow, smooth motion. Only move your arm and head as far as it feels comfortable for you. Start gentle. As you practice this day by day, if you feel that your range of motion increases, that's just great. It's fantastic to move a little bit farther into your available range of motion as you're able to, but don't push it. It's better to start out slowly and more gentle and then build up with repetition. Now for the left side. Start with crossing your left arm over toward the right side with your palm down and look down and tip to the side as if you're looking into your left armpit. Pause and then open your arm, rotate your palm up and look to your right. Turn your head to the right. Pause and cross your arm, rotate palm down and tip your head to the left. Look down. And now open your arm, palm up, and look to the right. Pause. Continue alternating the arm movement and head movement in a coordinated fashion with slow and smooth motion. For best results, do these exercises 1 to 3 times a day. You might begin to notice improvement after just a few days. But typically, lasting improvement requires daily, consistent performance of these exercises for about 6 to 8 weeks. You might also benefit from some of my other videos covering neck and upper back issues. See the links in my description below to check out some of those other videos. Okay, this wraps up these flossing exercises for dorsal scapular nerve entrapment. If you like this video, please click the thumbs up and subscribe to my channel. Please leave any questions and comments below, and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a wonderful day.